Good morning and welcome to Mile High Living. I'm Gina Bellich. We all know that depression is hard, and for a third of people, antidepressants just don't work. In fact, many people spend years and sometimes decades in the search of a remedy that will ease their suffering. And joining us today from Alleviant Health Centers of Denver is owner Chris Perez and psychiatric nurse practitioner Harmony Wright. And guys, we were just saying what a timely event to have you here today, because so many people are dealing with this type of situation right now. The year we've had, the holidays coming up, everything that we've got going on. Let's talk first with you, Chris. And your clinic offers solution to people that a treatment really that is resistant to depression. Something that that can help. Talk about what is TMS.
Yeah, thank you for asking. TMS is a non-invasive treatment or procedure for the treatment of medication-resistant depression. And what it means is transcranial magnetic stimulation. And what we're doing is we're using magnetic energy to stimulate the left dorsolateral prefrontal cortex.
That's a lot of words.
Yeah, I don't expect you to repeat that.
On a Monday,
that's the DLPFC, and that's the region of the brain that's affected by depression. And we want to use that stimulation to help rebuild pathways in the brain that are damaged by depression, help those neurons, those brain cells talk the way they should. And what's great about TMS is that in almost 80% of patients that have been unresponsive to traditional antidepressants, they feel better. In 50 to 60% of those patients, they're getting complete relief of depressive symptoms. And that's in 6 weeks of treatment. 6 weeks, 5 days a week, 4 minutes a piece. That's 120 minutes. I'm a math nerd, so I like those numbers. That's a long movie. That's like one of the Harry Potter movies.
That's actually some impressive numbers that you're giving me right there. All right, Harmony, let's get it more specific. How does TMS work?
Okay, so TMS works by delivering magnetic pulses to the region of the brain that's associated with mood control. And this magnetic field is unique because when it goes through the skull to the cortex of the brain, it's not distorted in any way. So it's a pure field of the magnetic field's pure, and then it also is directly going to the part of the brain associated with mood and not stimulating or aggravating any other parts of the brain. So once the magnetic pulses are inside of the brain, it then induces an electrical current at the cellular level, and the cells can then reset and then activate those cells which have been dormant when people are experiencing long-term depression. So the magnet is then also it's centralized to the part of the brain, and it's because it's directly over the part of the brain associated with cognitive function, that people are then, once they experience TMS and go through the treatment, they are then better able to make decisions, talk about their emotions, things that are hard for them in therapy, and then feel like they have better control over their thoughts and behaviors, which helps them make better strides in their treatment and in their therapy. So essentially, TMS helps them get better traction in therapy and feel better quicker.
Okay, it's sort of the chicken and the egg thing there. What comes first, right? But when we talk about the brain, the next question I have is, what are there side effects? That's kind of a common question, right?
Yes, yeah, because it sounds, really scientific and like, oh my gosh, what are you doing with magnets? So the good news is there's very little side effects. People might have a mild headache, but you can drive yourself to the clinic, you can drive home. If you had to go to work that day, you could go back to work. So there's zero downtime with this treatment. And what we see and what the data suggests is that people actually take less medications or come off their medications altogether and are returning back to the level of wellness that they want to obtain before they did TMS or did treatment.
Well, a literal peace of mind, if you will. That's what so many people suffering from this want. Chris, talk a little bit about what this process looks like.
Yeah, definitely. So first you would schedule an appointment with one of our wonderful providers. We would make sure that you're a eligible candidate, that it's going to be a good fit for you, that you don't have any contraindications. We will get a prior authorization through your insurance company, so it is covered by most insurers. A lot of people would pay just a regular copay, or some folks pay actually nothing. We'll bring you in the day of treatment, and like the video showed, you sit in a very comfortable reclining chair. You have a small electromagnetic coil placed against your head, and in 3 minutes you're done and out of the door and driving yourself home. You come in for 5 days a week for about 4 minutes each, and in 6 weeks, we hope that you're moving on with your life and enjoying life so much better.
All right, well, if this is, triggered anyone at home thinking, I might want to start this, how can people get started?
They can call us at the clinic, 720-400-7025, or email at newpatients@alleviant.com or alleviant.com/Denver.
Okay.
And we can get people in as soon as late this week.
Oh, that's what I was going to ask next, and that was, well, that's all fine and dandy, but it's going to take 4 months to get in, So you said by the end of the week, maybe?
That's correct.
All right. Well, we appreciate you guys being here. Timely, again, topic for everybody. Thank you so very much. Heal the root cause of depression once and for all, instead of just managing symptoms. You can request an appointment by visiting Alleviant.com or by calling 720-400-7025. They paid for today's segment, and we'll be right back. Thanks, guys.